I'm here tonight as someone who was also born and raised in Kettering and in the north end of town. And now I'm raising a family of my own there too. I want to share with you how important the meadow and the woodland are to me, but through the different lenses that I look through. As an individual, as a mother, hopefully as a grandmother in the future, although my teenage son says no at the moment. Um, and lastly, and perhaps differently, as someone who is a public servant in this county and a member of the emergency services, I work every day with the sole goal of keeping people safe, healthy, and well. Our main concern really is that Kettering and its communities post-pandemic have really, really different needs to the ones pre-COVID when strategies applications were written. Our integrated care system has generated some great local area partnerships across the county and here in North Northants. And at the moment, those partnerships for the Kettering urban area and the Kettering rural area are looking at public health data that is publicly available and also gathering community insights as to those wider social determinants of health and what people want for their area. In both of those areas, Kettering rural and Kettering urban, community mental health and well-being is a major priority. What that means is that everyone around that table in the partnerships, the agencies, the statutory bodies, the charities, the community organisations, we have all agreed to prioritise efforts to prevent escalation of poor mental health and to improve emotional well-being of people in our communities. And we've ready from youth works about what that means to young people in this town and in the north end of Kettering. So we know our health service can't cope with the tidal wave of mental health that is happening now and has been happening for a number of years. So we signpost people to advice, top tips to keep themselves safe, well and healthy. All of that advice, and it doesn't matter where you get it from, whether it's from a national charity, a local charity, our local authorities or the NHS, all of that advice tells us that being physically active, and more importantly, being physically active in nature, connecting with flora and fauna is vitally important and has a massive impact on all of us. It's documented, it's evidenced, it's proven. And that is why we're all here, because this is what we're doing in the meadow, in the woodland. We are looking after our own mental health. We are improving our emotional well-being. Nowhere in any of that published advice does it tell me to walk in the shadows. Nowhere does it tell me to walk alongside a huge metal structure that blocks out the sunset or the sunrise, that drowns out the noise of the birds and the insects. Nowhere is that published as being good for me, for my children, or anyone else in our communities. So I wanted really to hammer home that point that many of us tonight have made about mental health. Yes, this might be about economic development, but at the heart of this are people and our emotional well-being count. Now, when I spoke to my teenage boys about tonight, the oldest one actually said to me, and this is unedited, so excuse it, is this actually for real, Mum? Has this really come to this? Does no one see that when you are teaching us to reuse, repurpose, recycle, does no one see that we don't need more stuff? We don't need warehouses because we don't need more stuff. We need to use what we've got, and we need to use it better. So don't take away this land from us to give us something we don't need. Thank you.